The African Medical Association says personnel are being stretched thin due to a surge in trauma cases over the festive season. KwaZulu-Natal also is experiencing an increase in road fatalities as travellers make their way from the province. A Provincial Health Department head, Sandile Tshabalala, joins us now for more. HOD, we really appreciate your time. Thank you so much for joining us. I think we have seen a sharp rise in trauma cases this festive season, particularly with fatalities, I believe, in Vryheid and in Durban. But talk to us about just how extensive some of these cases have been and really what you believe is driving the increase.
Good afternoon to yourself and good afternoon to the viewers of your program. Let us start by passing our condolences on behalf of our MEC and our government to the families that have lost their loved ones due to any of the mishaps that have happened. You have mentioned a minimum of at least 2 accidents that have happened in our province. One of them is an accident that happened and involves one of the known musicians of our country, the family of that musician. Really there, it was an issue of a sheer accident where one of the vehicles they were traveling in lost the brakes and it hit the one that was behind it. It was really a very bad accident where a few people, more than 7, have passed on. It was not really due to speeding or any of those. Then there is a second one that happened around N2, around Durban, which involved the issue of speeding. But in general, we can report that in our province, generally speaking, and compared to last year, the number of fatalities or accidents in our province has gone down. If we look at the statistics, we are still compiling the exact numbers, but what we have picked up is that they are less than what we have seen in the past year in particular.
Yeah, but of course what we are hearing is that, and this is also coming from the South African Medical Association's chairperson, Dr. Mvuyisi Mzukwa, highlighting the strain on healthcare workers due to staff shortages. So talk to me about that and how the department is working to address that challenge.
The issue of staff shortages is not a new one. It is not an issue that comes now that there is the festive season. As a province, we did devise a festive strategy or festive season strategy but also a disaster management strategy where we aimed to ensure that, among other things, we've got enough or relatively enough resources for managing these disasters should they happen. Now, among these resources was the issue of enough or near enough human resources. So the shortage of staff has been there even before that, and it is definitely a strain on the department. What we then are doing is to look at how do we selectively fill posts that will make sure that the people on the ground are filled, or the post of people on the ground are filled more than the people in the offices. In that way, the strain will be less on all the people on the ground. People on the ground, I'm referring to nurses, doctors, and all the other categories of staff, because we are not only talking of doctors and nurses, but all categories. So we are trying to see with the available resources, particularly financial resources, to fill those posts. It's not as quick enough because it also does depend on availability of posts and availability of funds as well. Yeah. So we are working on it.
Yeah, as we come out of the festive season, obviously in the days to come, there's going to be a lot of movement to those that are making their way, for instance, out of KwaZulu-Natal, which is a very popular holiday province. Talk to me about how the department works then with other departments like traffic authorities, for instance, to improve road safety, particularly in areas like Vryheid and Durban, where accidents have been more frequent.
You may have heard our MEC for transport in the province saying they are having roadblocks here and there. And he says, KwaZulu-Natal, alfakwa libuya nomuntu, where he meant that if you are found to be going against the law in KwaZulu-Natal, particularly in the roads, you are going to be arrested for doing that. So we are warning people that they should be careful of what they do. They also should behave correctly in terms of drinking and driving. This is a message that we started to speak to even before the festive season. But on top of that, we are prepared in terms of transporting people from one place to another should a need arise where accidents have happened. And that is not only done by the Department of Health, but also there are private ambulances that are doing that work together with our ambulances, the government ambulances. So there is coordination or collaboration between the different departments, but also the issues of community safety do get to be taken into consideration. Remember, we're talking about road accidents, but other traumas that happen speak to the issue of gunshots and stabbings and other blunt traumas.
Yeah, well, we really do appreciate your time. And of course, I imagine that we'll be talking quite soon in the days to come as we start to see people moving. But we do appreciate your time. That there's Sandile Tshabalala, who is, of course, the KZN Department of Health, HOD.